Welcome to the Translate Your Doctor podcast. I'm your host, Patrick Figures, joined as always with my co-host and best friend, Dr. Trey Sertish. Trey, happy Wednesday. What day is it even? You and I.
Happy birthday. Is what
Thank you very much. My birthday, February 23rd. I survived the snowpocalypse in Texas last week. You did as well. Mm-hmm. Did you? You didn't have to work last week, right?
I was off service, thankfully.
Thankfully, my gosh, it's absolutely insane. I think patients and anyone else, a lot of the physicians that I know were able to work from home and doing televisits, one of the privileges of working in this digital health society economy, but heaven help and thoughts and prayers with anyone that needed to work in a hospital and had to try to figure that out. A lot of long shifts for physicians and nurses, I imagine. But you and I also did something interesting last week. We had our first Translate Your Doctor seminar last Sunday, which we had with a relatively intimate crowd of, I think we had 7 people that showed up, something that you and I have tried to figure out, which is we've got this podcast. You and I have this desire, this mission to focus on people, not problems, patients, not problems, and really to make medical information and empowerment more accessible to the average patient, which we're doing under this Translate Your Doctor moniker. And the seminar was really our first foray jumping into that. Living with heart failure is, I think, what we labeled it as. And you put together a 2-hour lecture that ran 30 minutes over because of the wonderful questions that we had. How are you thinking about, I mean, it's so fresh, we're a couple days after, how are you reflecting on how you think it went? And what are your takeaways as you and I think about what in the heck are we doing with this brand that we're trying to build here?
Yeah. Well, again, we were just talking briefly before, and avoiding all confirmation bias, I just felt great about it. I mean, I did. I felt great about it. It really reinforced why we thought to do this and why it's important to us and specifically to me. And it just felt like it was filling a hole that my clinical practice doesn't offer. It just, having that kind of relationship with patients who are not in the hospital really sick in that moment, but still have all these questions, still have all these needs and desires and fears and excitement when they've recovered and they want to share that. I mean, it just, we saw the gamut of, even with just this small patient population, I was surprised about the diversity of types of heart failure. It was pretty shocking, actually. And then also their stories and where they are in their disease process.
Something you and I have talked about offline is, as much as you and I feel really passionate about what we're trying to do with Translate Your Doctor to reach every patient, hopefully, and empower them with how to take control of whatever condition they're living with, there's this fear, I think, when you do a podcast, when you do a creative endeavor, that no one's going to listen, that you're going to put all of your heart and soul into something and that just you're going to knock on the door and no one will be home. And so I think there was something to the fact that anyone even showed up. We offered it for free, but even that, weren't exactly sure that anyone would care.
Yeah, it was 2.5 hours on a Sunday. I was shocked. Again, when you texted me, whenever it was, 2 weeks ago or something, that one person signed up. I was like, wow, that's, incredible. I'll take that as a victory and so on. And then you just kind of slowly populate, this person. Even during the actual lecture and seminar, no one dropped off. That people were just there and engaged, and they didn't have to be. And I think that I hesitate to equate that with what we're offering per se. I don't think we need to blow our horn loud from that and brag, but I think it speaks more importantly to like the need, like that, how much these people needed this, and which we suspected, which is why we did this, right? Getting into that confirmation bias question, but it really felt like that. It really felt like they needed this, they wanted this, and we were offering this. And when those things line up, it just feels really, really, it's one of the most valuable experiences as a physician I think you can feel, and as a person. It's just that I am offering something to somebody and they are exactly looking for that thing. And that just feels really, really good when they align.
Yeah, you and I have a hypothesis that there's a gap. And what we want is for patients to also perceive that there's this gap, that we can meet them halfway in having this conversation with them. So how are you thinking? We've talked a little bit about this offline, but we've saved some of this for this dialogue. How are you thinking about how we construct these talks going forward? We had thought maybe that's our business model. Maybe we charge for these talks, for these sort of crash courses on managing certain conditions. And now it feels like we've swung in the other direction, that maybe we just offer those as a way to evangelize free to patients to just help as many people as we can. And then if we can have a deeper relationship after that, then maybe that's the goal.
I mean, that's what it feels. This is changing all the time because I think our experience is determining that. And I think you got to be careful, right? Just like when you're practicing, when you're taking care of a patient, you don't want to let the immediate always change what your treatment decisions are going to be, because you can be too reactionary. But I like this idea that we're honing in on what feels really good. Like, especially after Sunday was so clarifying for reasons I just discussed and that you're hitting on, which is just like, man, it felt really good. I don't really care if I get paid for that. Like I'd rather just continue that. That feels really nice. And so I think that's really useful. And I have a sense, I'm a very optimistic personality. I think you do too. And I think that if you do good work will come to you. And I think if you're persistent with that, that especially holds true. So my idea is that, yeah, continuing to build that goodwill, continuing to fill that need, continuing to build those relationships will fulfill us in the end, not only from like an affirmational standpoint, but offering business opportunities if we want to continue that relationship.
Yeah, that's well said. That's exciting. I think it's really nice to feel like we've got the podcast, which we're trying to promote. And each time we do an episode of the podcast, I try to grab some clips and post them online and just get people aware. There's a joke in the startup community around, if you build it, they will come. And that's like not at all true. Like if you build, you can build the best. It's sort of if a tree falls in the forest and no one's around, you can build the best product or the best service on the planet. And if you're not promoting it, if you're not telling your story, if you're not trying to evangelize, it's really difficult to get off the ground. So I think that's what you and I are doing, is trying to evangelize, to just help people, to just connect with people. And that if we help people, connect with people, if we keep putting out content that's valuable and offering it free, giving it away free, you and I, we don't quote unquote need the money. We're doing this on the side. If it can turn into something that has legs, wonderful. But gosh, we're certainly not going to do that at the expense of helping people. So we front loaded, how do we help as many people as possible?
Yeah.
And whatever we need to do after that, we'll follow along with it.
Yeah.
Well, that's exciting. Well, this is a fun little experiment, just doing some of these retrospectives. I'd like to do more of them. I like just having the dialogue and making it available. In some ways, it feels like we're building this business as a service to the public. I like the idea of sharing our thoughts on how what we're doing evolves and trying to do things that make sense for the patients out there that need folks advocating for them.
Yeah. I think I would say the last thing that comes to mind before we move on that was really meaningful about it is that recognizing that the patients, or at least some of the patients in the group, offer just as much, if not more, than what I was talking about. And we all understand inherently, I think, or at least are taught to understand as doctors, that like peer groups are important and social connections are important, whether they're family, friend, or just like a social network like this one from Facebook offering just heart failure patients. That's the only thing that links these patients together is their diagnosis. And yeah, but you can get such benefit from that. For instance, one person having their diagnosis for multiple years and kind of coming to the other end, still having to take medicine, still having to see doctors, still having scares every once and then, but just feeling like they have it a little bit more under control, versus somebody who's had their diagnosis for months and is still very much in that new phase of like, everything's scary, all the medicines feel weird, it's hard to do this, I don't know what's going to happen. And just, we're not doing anything necessarily to facilitate that. And those two people are helping themselves in that moment. And, I think that that's just extremely meaningful, and figuring out a way such that these seminars can always offer that, I think will make the perfect kind of intervention.
This reminds me of cohorting. You've talked about that before, that in medicine, we're not very good about cohorting patients, which is every patient is suffering alone to some extent. There aren't support groups attached to every practice. There are obviously support groups that exist out there in the larger universe, but it's rare to get plugged into them. And said a different way, the patient has to do a majority of the work to get plugged into a group of people that can really relate with what they're going through. And there was this element of support that we seem to have with that group. It's a Zoom class, it's a Sunday, it's You and I have never really done something like that before, but it was nice to get people sharing. It was nice getting people
Hmm.
to open up, to facilitate some of that connection. And I think you and I have challenged ourselves, and how can we continue to do that at a larger scale? How can we cohort
Yeah,
more people, especially, and which is especially easier to do when you have common conditions, when you have
absolutely.
commonalities between patients, because they can really connect over shared questions, shared experiences, makes it a lot easier. It's one of the values of these digital tools.
Yeah, I'm like reflecting. I'm listening to you, but I'm also reflecting in the same moment. I'm like, why would like, why does it happen? I know it does. We're not being fair to all different care models that exist in this nation, but I just don't see it very
I think
often.
it's the exception, not the rule. I think that's a fair thing to say, and
Yeah.
I'd certainly challenge anyone listening that has examples of how this is a common practice. It is.
Mhm.
Our medical system is, a, as we've talked about, the incentives are 50-year-old incentives.
Mhm,
The incentives
mhm,
are
mhm.
decades and decades old. Innovation is
Yeah.
hard in this system because there's not a catalyst for big
Right.
changes, which is again why you and I have tried to put something together that can change the culture around medicine, change the conversation around medicine, trying to meet patients where they are, and experimenting with what will help patients, what will be meaningful to patients, and how can you and I figure a way to reach people in a way that's meaningful for them.
Yeah. Because I feel like if you mentioned that to a lot of other doctors or healthcare providers, they'd be like, "Yeah, I mean that makes a lot of sense and stuff." It seems logistically difficult, particularly with like HIPAA or privacy issues. How do you reveal somebody's diagnosis to another? And I think I would like understand that, but then I reflect on, but wait a minute. For one of the most like socially sensitive topics that we have, like substance abuse, there's like an outward it's in fact like common knowledge that you should have a peer network that you can rely upon if you're an alcoholic or a drug addict and or you smoke and so on, that you should involve other people who struggle with the same thing and are at a different place in their sobriety or struggle, to help you. And that is something that most people definitely want to keep private, yet we as an institution in healthcare like are saying like, no, 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 you have to make that public, you have to put yourself out there. So why isn't that the same for things like, we talked about heart failure, but it could be any number of things that seem far less sensitive
Yeah, and
than
you'll have to
that.
tell
So,
me. I mean, I'm curious. So back to medical
mm,
education, right? Like, I don't understand why that isn't a more common discussion in medical training. Like that behavioral interventions are a common practice everywhere, and obviously, behavioral economics and
mm,
each of us that live in our daily lives, by the time we're 30, we understand like how much our mental state and our mindset and our emotional state like affect our outcomes and our behaviors and habits. It's surprising to me that that doesn't factor more into how we think about care plans and interventions with patients.
well, and just to briefly touch on, I mean, when I reflect on, why doesn't this happen in education phase? And that can be in undergraduate medical education, which is medical school, or it can happen in graduate medical education, which is residency training, right? When you're a physician, you're training to be your specialist of whatever form. And at both instances, generally speaking, what you're trying to ensure is competency and not excellence per se. I think a lot of institutions would push back, including my own, and saying like, we of course want excellence. But I think when you get down to it, what your institution is most concerned about are those who are failing, are those who are just passing. You really want to make sure of that, which I think is good reason. Nobody wants the medical school or a residency to graduate somebody who can't cut the mustard. And then there's a lot of downside to that. So a lot of resources and focus are spent on that. That's understandable. And I would just say that there are unintended consequences for that, which is if you're focusing a lot on that, it can seep into other things, which is med school's hard. Practicing medicine is extremely challenging. There's an enormous amount to know. We don't even touch really the tip of it when you're even through training. That's why you call like practice, right? You're practicing for decades after, and you never really truly master anything. You just gain more experience and understanding. And hopefully you're reading and paying attention enough to really offer excellence to your patients. And so my point is just to say, I think that behavioral interventions like that are remarked upon and are acknowledged. But I think that the overwhelming nature of being like, I just have to know all the medicine, I just have to know all the basics of being a doctor and being good at that, and to think like how could I activate my patients to help other patients is it's just a little much. It's like if you reflect on when you first learned to drive,
Hmm.
And the concept of just getting on the highway and merging, and how scary and challenging that was to do that, to just, oh, when I turn my head, the car goes with me, and like that's really scary. And you just need more time, more experience to really get good at driving. And that's the same kind of thing in medicine. There's a lot of data, there's a lot of things, and you just want to like merge onto the highway
Hmm.
without killing anyone. And the thought of being like, well, do I need to like work with this driver 2 lanes across to do something or pay attention to? I think that's extremely overwhelming because you're just trying to maintain your car and your safety. It's not a perfect analogy, but I'm left thinking about that
I
when you
appreciate that.
remark on it.
It makes me think of, this is why more holistic and whatever you define as fringe, functional medicine, I get why it's come up so much, because there's this vacuum that's been left by the traditional, Western practices of teaching medicine. And I see a lot more patients inquiring and thinking like, there's some unmet needs here. I need to talk to someone that will take a holistic look at my life and work with me on that way. I can really empathize with those patients.
Yeah, and that's its own. I mean, we could do an entire episode, a series of episodes on that. Why has holistic medicine sort of been thought of as a bad thing from the point of allopathic medicine, which is MD medicine, or osteopathic medicine, which is DO medicine? Just think of them as synonyms.
Though I do think we could probably,
Mhm.
let's see if we agree on this.
Yeah.
To the extent that holistic medicine, or functional medicine, or more
Mm,
non-traditional, I don't know the right term, whatever the
sure.
proper
It's
term is.
wellness. That's the hot term
Yeah.
for it, right? Which is wellness.
Whenever that tries to supplant traditional medical practices, danger. Complementing traditional medical practices, that seems completely appropriate.
Yeah, I just think that they're not the same thing. I honestly, when I reflect on it, and I've been thinking about this more and more. I actually talked with my dad recently, like 2 days ago. He's a physician as well, but he's also, and it has less to do with his physicianship as it does with his spirituality and religion. He's Catholic and I'm not. I was raised Catholic, and we were just talking about spirituality and what it means to him, what it's meant to him over the past decades, and so on, how that's evolved. And I talk about this with other folks, yourself included, and just that a lot of structural support for the challenges that life brings in our society have like kind of eroded over time. Like people are less religious now. There's a lot of political strife and people can't seem to trust their systems and institutions. And it's been harder and harder for physicians just to do their job, because traditionally physicians offered much more than just medicine. They really, or should anyways, have been there despite no treatments to see you through to your death or your illness or your suffering, to be there for your family members. And many physicians still do that, don't get me wrong. But as like the amount of knowledge has increased, as the amount of things we do has increased, diagnostics, procedures, all this stuff, I think that that's starting to push out the other things that physicians should do very well. But there's no one else to catch that, right? You could rely upon your priest, your shaman or whatever to really help that, your community center, your leaders and so on, to like capture all those things, because people still need them. Even though it's not the 9th century, humans are humans and we still require all this stuff. And I know I'm like sort of stretching it, but what I mean to say is holistic medicine, I think, addresses a lot of those things, which is, doc, yes, my knee hurts, but I'm affected by the fact that not only does my knee hurt, but I can't do the things that I wanted to do. And I want to talk about those things. And I need to express that, and I need to mourn the death of me as a basketball player because I can't play basketball with my friends anymore because my knee hurts so bad. And you telling me to use this gel or this like pill, and it doesn't solve that problem, and that's the end of our relationship. I got to get it somewhere else. And so I'm meandering a little bit, but I just think that, again, getting it back to our experience with the seminar and seeing what patients can offer themselves, I think that's what Translate Your Doctor feels really good about, which is how, again, do you facilitate getting all the way back? Physician, patient, there's a gulf between them. How do you bring them together? And part of that is like building that relationship to be more holistic or well or whatever, to fill these holes that we're losing, or seemingly it feels that way, losing in our communities and societies. I know that was a lot.
That's
But
great, man. No, it's very valuable. It's good. This is I think that's a good spot for us to stop. Short episode, bonus episode. Nice to have an open conversation about where we think we're at with Translate Your Doctor, what we're trying to do with the podcast, with the brand, continuing this exploration of what we think is quote unquote wrong with healthcare, blocking the physician-patient relationship, but also taking a break. I think of every listener to the show as a stakeholder, as a shareholder, as an investor in what we're doing. They're taking the time to listen. And I think you and I owe it to them to do check-ins and talk about what we're trying to do and involve them as much as possible in what we're trying to build and how we're trying to make a positive impact on the healthcare community.
Yeah, I love it. Man.
Awesome, buddy. All right. That's a good spot for us to stop. All right. We'll talk later.
All right. Adios.